you don't get a trophy. Your trophy is a healthy baby. I need to change my job because my job doesn't allow boundaries. Like being a private practice OB-GYN, you're essentially available 24/7. Pager goes off. You have to run, go do a delivery. That's why I actually started my Docs Women's Health on like TikTok and Instagram. And also start putting out informational videos to help women. I feel like it stretches you to limits that you didn't think you could be stretched to, but you have to get stretched to them because you're a mom.
This is Mothering Holistically, a podcast amplifying everyday moms' voices, creating a relatable space to share stories, practical tips, and inspiration. We empower moms to embrace every season of motherhood with confidence and pursue their dreams with resilience. I'm your host, Kaylee Berlini, a mama finding balance in motherhood because balance is key when mothering holistically. So no matter where you are connecting with us from, please subscribe and give us feedback as we continue to make this podcast motivational and helpful for you all. So today I'm super excited because we are chatting with Dr. Christie Porter, a board-certified OB-GYN educator and mother of 4, including a set of spontaneous twins. She is the founder of The Informed Woman, an educational platform empowering women to approach pregnancy, birth, and postpartum with confidence and clarity. So please give a very warm welcome to Dr. Christie Porter. So hello, how are you?
Hi, good. How are you?
I'm doing fantastic. So first, just kind of say hello and, share how motherhood, especially with twins, has kind of reshaped your perspective on women's health.
Yeah. So first of all, thank you so much for having me on.
Yes.
Motherhood has honestly completely changed how like I approach patients. So I actually had my first child in my last year of residency.
Okay.
And I remember like seeing patients and being like, oh, you're uncomfortable, you're fine. And then like I actually became pregnant and was like, oh, like this is actually hard. And so like I felt like it allowed me to connect with women on like a deeper level. And then when I got pregnant with my twins spontaneously, um, it made me think, okay, like where are my priorities? Like where are my children? Where's my job? Because I love my patients. And just being pregnant with twins and working and all the aches and pains, like it allowed me to feel more pain than like some of my patients have this pain, but I never had felt it like with my sciatica and like my SI
Yeah.
joints and all that stuff. Like my twins, it was
Yeah.
really bad. So it gave me more empathy towards them.
Mm-hmm.
And then
Mm-hmm.
also like the recovery part, because I had to have a C-section with them. So like I've
Yeah.
experienced the vaginal delivery of the C-section. I breastfed my oldest 2 for over a year for both of them. And then my twins, I didn't produce enough milk for both of them. So I actually ended up having to supplement and then ended up being pumping and supplementing. And then my milk dried up and then just formula. And so
Okay.
I feel like that allowed me to go through, I actually kind of went through a grief process of, being like, okay, this is what my body's doing. And it just kind of made me help understand like women on a deeper level when they want
Mm-hmm.
to breastfeed, but their body is not
Mm-hmm.
meeting them to that level and how to kind of
Yeah.
process that. So I feel like that's been kind of like my journey through life and as also being a physician.
Yeah, I love that you said that because, when
Yeah.
before I had children, you kind of are like, oh, I completely understand, or you're trying to
Mhm.
connect and, like you said, empathize, but it's completely different when you actually go through it and
Yeah.
you experience it. And I went through C-section as well. I didn't really know a lot before it.
Yeah.
And I think my mom kind of told me like you kind of don't want you kind of don't want to know how it actually
Yeah.
happens. And I ignorantly or maybe I just felt, I don't know, I'm just going to say it with no shame. I didn't feel like
Yeah.
having a C-section was on the same level as vaginal birth. And I was really disappointed that
Gotcha.
I couldn't give birth to my daughters vaginally. And I genuinely felt that when I did have a C-section, I wasn't going to feel anything. And I felt
Yeah.
like I was going to have this complete disconnect from my body. And it was not like that. It was
No.
not like that at all. You definitely feel the
Yeah.
pressure and the pushing and the pulling
Hmm.
and all the things.
All that.
Of course, you're like laying out, like a cross, and it's like,
Yes.
but um, but
It's so
that was
true.
that was a very interesting experience, and I was like, no, C-section is definitely giving birth,
Oh,
and luckily with
yes.
technology, we're able to not die anymore. So
Yeah.
I feel like that's the difference now.
Right.
Hmm.
I am so happy you brought up the laying there like a cross. So I mean, I've done thousands probably of C-sections, right?
Wow.
And I've never actually thought about that until I was on the table, butt naked, just the top part covered and waiting for everything to prep to dry. And I delivered where I work. So every single person in the room I work with, I know very personally. And I never
That's
understood that
different.
awkwardness.
Hmm.
Yeah, and so I thought it was funny because I worked 2 days ago, and there was a lady that we were doing a C-section on, and she was just laying there. It was her first C-section. She was like, "This
Hmm.
is weird," and I was like, "Yes, it is," and I know exactly how you're feeling right now.
I'm surprised
Yeah,
she was like, I was
yeah,
in a completely different state of mind
yeah.
when I had, like, I was not um, really able to communicate with the staff. I was sobbing, and
You're focused. Oh,
yeah, I was in a different frame of mind. I was scared, if I'm not gonna lie.
yeah,
I was very scared. I was scared for myself. I was scared for my daughters, and I feel like the crying took over once they started, because
yes,
I had a scheduled C-section, and then my water broke 2 weeks
yeah.
before that, and so I was terrified because I had been
Gotcha.
watching stuff on YouTube and watching different people's stories. And my biggest prayer was, I just wanted my daughters to come home with me. I wanted them to be healthy. And
Yeah,
no one wants the NICU, so that was like my biggest
right.
prayer. So when my water broke 2 weeks early, I was devastated, and I was like, they're probably going to need to go to the NICU. And so I was just in that frame of mind. And thank God
Yeah,
for me, they didn't have to go to the NICU, and they were able to go right into postpartum. But I feel like that's like, I'm like,
yeah,
that mom was able to be like, this is weird. I wish I was in that
yeah.
like fun
Oh
frame of
no.
mind.
Yeah, no, and I get that. And one thing that I do, actually, if I notice a patient's crying like that, I'll hold her hand and talk to her till I need to go scrub in and stuff, just to kind of
Oh,
calm
that's
her
good.
down. But I had my twins at 36 weeks, so I know exactly that
Mm.
feeling because I went to
Mm-hmm.
preterm labor, and I was
Mm-hmm.
like, please don't go in the NICU. And thank heavens, mine also didn't go into the NICU. They were
Oh, okay, good.
borderline going there, but they were able to stay with
Yeah,
us. But I get
same.
that scared.
Mm-hmm.
Yeah, because you don't know. You don't know if they're going to come out
Yeah.
screaming, crying, and and doing all the things they need to do. But yeah.
So,
So
how did your professional training prepare or not prepare you for the reality of twin
yeah.
motherhood?
Oh, that's a hard one. So I feel like my professional training kind of prepped me for like the whole pregnancy process
Mm.
because like I know what kind of testing you get done. I know what
Mm-hmm.
gestational age that you deliver twins at. Like the theory of tandem breastfeeding, which I did for a little bit, where you are just splayed for the world and just holding two babies up like this. I like you know exactly what I'm talking about.
Yeah.
Um, it's so like that kind of like prepped me for just like the medical aspect of it. What it didn't prep me for is like the actual reality and the logistics of twins.
Okay.
Um, like the whole, okay, you need two car seats, you need two seats in a stroller, you need a breastfeeding pillow, which is the Twinsy pillow, which I think is the most
Yes.
amazing thing in the entire
Yes.
world.
Yes.
Um,
Yes.
like, okay, I have to feed this baby and this baby. How am I going to comfort that baby and comfort that baby at the same time? It's just like this is terrible to say, but like, so my husband's also a physician,
Hmm.
and he's ER. And so we've never co-slept with our babies, like our two older ones. We were very like anti co-sleeping because he's dealt with SID babies. I've seen SID
Mm.
babies, it's a very like real thing in our world.
Yeah.
Oh my
Yeah.
gosh, first night home, I was in the recliner with one baby. He was in the bed with the other baby. We were like, we're so tired. And I just feel like with twins, like all of that just goes out the window because you were just in survival mode. And we
Hmm.
have never co-slept so much in our entire life. it's just like the
I'm,
random things that you were like so strict about with the first ones, and these ones you're like,
yeah.
you're alive, you're great, we're fine.
Yeah, I'm so glad you brought that up because my mom's ER, so she's a trauma
Yeah.
nurse. And
Yeah.
she came home and helped us and everything like that. And we got so much pushback from our entire family about co-sleeping. And
Yeah.
it was just like, especially, in the beginning, they're preemie, they're ravenous, they're super hungry, and
Hmm.
you're just like trying to sleep, it's just, I
Tired.
mean, you've been there. Yeah, you've been there. And it's like, I'm just trying to do what I can do
I just
because I'm tired
it's
and they're
exactly
nursing. And, I actually got on the floor and camped like that so that there was no, I mean,
yeah.
yeah, so there was no like possibility of them like falling on the floor. So that
Yeah.
really helped. And then I was able to kind of like side and then hop over inside,
Yeah.
that type of thing. And
Like here's
then,
this one.
yeah. But then I went to my lactation nurse, was able to get the tandem on point. She also taught my
Oh,
husband and my mom because I personally, I
okay.
just don't think it would have been possible if I didn't tandem because that one at a time was
Yeah.
awful.
Did you not have a lactation nurse come see you when you were in the hospital?
Yeah, but I just think there's so much that you are
Okay.
consuming mentally, and then of course you just
Yeah.
had your babies, and I have a really good like she was like, "You're really on it when I'm talking to you," and I was like, "I'm trying to remember," but the
Okay.
tandem was really hard.
Yeah.
Um, I've
Yeah.
never like I even had a joke when my nephew was born. I was like, I'll help you change his diaper. He was probably like, I don't know, 3 weeks, 4 weeks, maybe a month old, something like that. And
Hmm.
like, I just looked down at him and he was crunched up and I was like, I froze. And my sister in law was like, move.
She's like, let me just do
I'm going to
this.
change my baby. And from then on, I was like, when you don't have a baby or you're not around babies all the time,
Yeah.
you don't realize that they come out so small. And typically when you hold a
Yes.
stranger's baby or someone you don't really know, they're bigger. They're like 3, 4, 5 months at that time when they're allowing other
Yes.
people to hold their kids. And so I took classes and things
You
because I
were
was
like,
terrified. And holding both of the girls,
yeah.
trying to do all the juggling and stuff,
Yeah.
that was hard. So then when we went and had like more
Yes.
focused care on nursing specifically,
That makes
that
more
and she
sense.
like gave us all the tools and like different tips and tricks and stuff like that was that's when we were like, we're gonna
Right.
do this because I don't know how else I could
And
get.
oh my gosh, no, tandem feeding is so hard. I think I made the comment of like, if I hadn't breastfed, like, I think I said, if these were my first babies, I would not be able to do this. Because like I've learned to latch, like I know how to put them on. And
Mm,
honestly, my husband, like he is a saint. But like he would help me get both babies in my arms. He
mm-hmm,
would help me do this.
mm-hmm,
And then like
mm-hmm.
my baby girl, she had a hard time latching. So like he would even do the hamburger hold to like get her like he was full on.
Yeah,
Like
so was my
props to him.
yeah.
I was like, I need help. He's like, great, I'll help you. And I was like,
Yeah.
thank you. But like honestly, like I don't know if I would have been able to breastfeed him like at all if they were my so kudos to you because breastfeeding is a journey and
Mm-hmm,
like you learn it as you go along. And I remember like
mm-hmm,
there were so many things with my first that I changed with my second and then with the
mm-hmm.
twins. Like it's a journey every time.
Yeah, yeah. And
Yeah,
I feel
yeah.
like sometimes it's like hard because, like you said, you do want to be able to nurse, and I know where I was at mentally when I was like, this is gonna happen. I'm gonna do this, and I had to really push myself because there's so many stories of people
Hmm.
not, and I think like you have this lived experience when you can't. I'm sure it's kind of devastating, and
Yeah,
I try to be more like empathetic in that regard because I know how I was so scared that I wasn't going to be able to. So I remember that feeling, but of
right.
course being able to, now I have that feeling of success. Um but the fear
Hmm.
of not being able to was um really scary. So I can only
Yeah,
imagine when moms can't. So I do try to be empathetic, but I think I also try to look at it from a standpoint of
yeah.
so many people thought I wouldn't be able to. And a lot of it, what I was
Hmm.
told was mental. So I am trying to also advocate for women who are like, I'm not going to be able to, I'm having twins.
Yes,
It's like, no, you can, you can,
you
it's hard,
can. It's a
but you
lot of
can.
work, but you could do it.
Yeah, you can. It's
I
hard,
know.
but
I
you can.
think mine was like I had like power pumping all that stuff like I used to do with my other
Mm,
ones to like get my supply up. I honestly just didn't have
mm,
the bandwidth or the time because at the time when my twins were born, my
mm-hmm,
daughter was 5, almost 6 years old, and then I had two and a
mm.
half year old. And so
Okay.
it
Yeah.
was, I
Yeah.
logistically couldn't do the stuff to like, like when you do the extra pumping to get your supply up,
Yeah.
there was all that stuff. And then also it was just the time consuming of sitting there trying to get them to nurse. And I see my 2-year old like jumping off the couch and like getting
Yeah.
into all this stuff because my husband had gone back to work and my 5-year old
Hmm.
is doing who knows what. And I'm just sitting there all out to the world displaying and being like
Yeah.
yelling, like,
Yeah.
get off of that. Don't do that. Because like when you're nursing one baby,
Now
like
there's
I
milk
could get up
flying.
and
No.
go do stuff. Yeah,
Yeah.
exactly. I could get up and just
Yeah.
hold them on and go grab stuff versus just sitting there being
Exactly.
like, I am helpless to the world. So that's why I ended up
Yeah.
pumping because I was like, I can pump and move and then like give them
Hmm.
bottles and I can still stand up to go get something. But
Yeah.
still mentally, it's rough.
It's
And
tough.
honestly, yeah,
Yeah, that's why we're really trying to wait to try again because twins are on both sides of
yeah,
my family and I have cousins with multiple sets and so I'm like scared that I'm gonna have twins again
yep.
and I'm like I don't know if I would be able to nurse if I had another set of twins.
Oh,
I don't know what that would look like, and
yeah,
like you just said, that's exactly what's gone through my brain of like I know my situation was super specific. They were my firstborn,
yeah,
and there's nothing else going around. It was quiet. It was peaceful. It was just us. So I definitely understand that my circumstance was different than like yours, already having
yeah.
two babies. And I was like, if I had twins again, I couldn't do this.
But I do have patients. I've had patients who've had twins, who've had older kids, who have successfully been able to
Okay.
breastfeed. And I think that's just their genetics. Like I have smaller breasts, and so like I don't have as much tissue to produce the milk versus them they had larger ones. So like all those kind of like genetic factors in there. But
Hmm.
you can do it. I mean, they did it. I was like, go you, you're impressive. All the
So,
breastfeeding.
so what motivated you to start the Informed Woman, especially with all that you have going on? You already have the career, the family and
Yeah.
things like that. How does this reflect your mission to empower moms?
Yeah, so this is actually the idea had been honestly floating in my head for about 4 to 5 years
Oh
prior to
wow.
this. Yeah, so it's just one of
Hmm.
those, it's like for an OB, we see about 26 to 30 patients a day. And they're 15-minute time slots, and that's including like gynecology, your annual visits, your OB visits, your new OB visits. And so you're usually double booked in about like 4 or 5 of those slots. And so you're just like kind of just going through it. And then also at the same time, you're managing a labor patient or you're on call for the ER. And then you have somebody who comes in with a ruptured ectopic and you have to run out to the ER and then come back and see those patients. And so I was
Wow.
noticing like there was more education I wanted to give my patients, but I
Hmm.
simply just didn't have the time for. Like if I had the time, honestly, on my lighter clinic days, my nurse who works with me, she'd be like, "Why are you in the room so long today?" I'm like, "I have time. I have time to talk to these patients. I have time to educate them and tell them all the things I want
Hmm.
them to know." And so that's why I actually started my Docs Women's Health on like TikTok and Instagram. Is because I was like, well, I'm like, I'll just start putting out informational videos to help women. And that's, I
Mm.
think, I don't know if you came across my like
Hmm.
C-section one because
Hmm.
mine I remember I like had the script down that I would just tell every single patient who was scheduled for a C-section. And I was like, you know, I'll just make this into a video because a lot of women don't know this. And so that's why I just made it into a video of like how to like prep yourself, like what your day is going to look like when you have a C-section. And so that's kind of why I came into the Informed Woman is because we focus so much on the prenatal care. And then there's not a lot of talk
Hmm.
actually what happens during labor and delivery. So that's why I created that
Yeah.
course. And then my postpartum visits, I was noticing I would like I'm only supposed to be in there for 15 minutes, right? Seeing the patient, but I would be in there for like 20, 30 minutes because there's
Hmm.
so much postpartum that I just had to like tell this woman before she leaves because it's
Yeah.
not just like, hey, how you doing? Breastfeeding cool. What's your birth control? Okay, get out of here, right? Because that's most postpartum visits are
Yeah.
like that.
Yeah.
And like me, I'm like, I want to talk about sex. I want to talk about like, yeah, you can have sex, but if you're not ready, don't be ready. And then I would just always say like, tell your partner I said no if you don't want to be the
Yeah.
bad person. I can be the bad person. Um, And then like breastfeeding, like going over like the emotional journey, like postpartum depression, postpartum anxiety, because it's not something that just pops up in the first 6 weeks. Like that's the whole year that that can pop up. And
Mm-hmm.
also, I don't know if you noticed this too, but when you stop breastfeeding, your hormone levels drop again. And so also you kind of get a postpartum depression anxiety when you stop breastfeeding. And
Yeah.
so like talking about that and
Yeah,
then
I'm
talking
glad you
about like
brought that
pelvic
up because I'm
floor
like,
health
okay.
and yeah, no, your hormones drop, so you go through a
Mm-hmm.
whole nother like postpartum essentially. And then like pelvic
Mm-hmm.
floor health, I'm like, first 3 months, like your body still kind of put that all back together. So I'm like, okay, if you're still having these issues, this is when you want to see a pelvic floor specialist. Like there's so many things in that postpartum visit that we
Mm-hmm.
just don't have time to do. So that's why I'm still creating that course because there's a lot of love going into it.
Yes.
And hopefully we'll be out here in the next month or so.
Mm-hmm.
But that's kind of why I created it, is I just feel like these women need more support than we can give them.
Mm-hmm.
And
Mm-hmm.
there's a lot up here that I can't get out that way because I don't have the time for it. And so that's why I've kind of started that. And then it progressed into me creating these courses.
I like that you
Yeah.
brought that up because, when you go into those appointments, you're like, hello. And then you wait for so long and then you're in there for 2 seconds and you're just like, why did I wait
Yep.
so long for this 2 second thing? And it was always a joke between me and my husband, like,
Yeah.
yeah, we're going to go wait so we can leave real quick.
It's so true, though.
But
Unfortunately, I feel
yeah,
bad,
no,
but it's
but
true.
yeah, but I love that you are also giving the behind the scenes inside look of why. And I know
Yeah.
in a lot of cases it's insurance and there's just protocols and there's, quotas and things like that that have to be met.
Yeah.
And
Huh?
so I really do love that you are like, hey, we are lacking the education and that's why I'm doing this. And I took classes prenatal and there is not a
Yeah.
lot of postpartum education out there. And I do feel like
Mm-mm.
more people are trying to educate. So I love that you're doing that
Yeah.
because I got really bad postpartum
Thanks.
anxiety. I feel that because
Mm-hmm.
I started to, talk to my husband and talk to people and I started this podcast has really helped
Yeah.
me honestly with my anxiety and with my depression. It's not I'm an entrepreneur at heart, so it's not only feeling that, but all of the information
Yes.
that I'm getting from the moms that I'm chatting with has really helped me and put life into perspective. And so I love that you said that. But
Yeah.
after nursing, yeah, it's been a little tough.
Yeah. No, I was
um,
gonna say you go through your own drop again.
yeah, yeah.
It's hard.
Heck,
And I
but
like just
women
just
go
to
through
tap
so
onto
much. No.
the we do. We really go through so much. So much. And I just want to say out to like all the mamas out there, like if you're feeling down, anxious, just talk to your partner, talk to your
Hmm.
OB, talk to whoever you feel comfortable with. I actually have So I basically probably had undiagnosed postpartum depression with my first kid. And then my
Mm,
second kid, I think he was 6 months old. And one of my partners, she just came up to me and she was like, "You're not okay."
mm,
She's like, "Well, we need to talk." And I think I had just been like being like, "Nope, I'm fine. I'm just tired. I have two kids. I'm an OB. Like this is all just this." And we had a good talk and there was a lot of tears. And
hmm.
I was just like, and she's like, no, you have postpartum depression and anxiety, like really bad. And we started me on some medication. And this is to props all mamas out there. I mean, medications, the way that I can describe me going on medicine, it was like taking the world that was gray and bringing color back to it for me.
Wow.
So, I mean, great if you want to power through it and you're going through it, like if you're seeing your therapist or you're finding your religion or you have your partner and you can get through it, that's fantastic. But if you're doing all that and it's not helping, I don't think medicine at all is like a bad thing. I honestly, day one of me having the twins, we just started me on meds because I was like, I am not going to go through that again. And it's been
Hmm.
great. I feel like
Hmm.
my whole
Hmm.
postpartum was completely different with my twins than it was with my other two. Um, and it's just like being a mom is hard.
Yeah, yeah, and I know that
It's so
we
hard.
all go through things differently,
Yeah.
and none of us are the same.
Yeah.
And I that's why I really try not to judge. What I would do
Yeah.
is completely different than what you would do because I don't have any idea how low you are or how down you are. And
Right.
it was definitely something for me. It was like I've never been like a violent person ever in my life. And I was starting to have like
Yeah.
violent thoughts and, slamming doors and different things like that. And I knew something was
Uh-huh.
wrong, and my husband knew that something was wrong. And so we really had to start. For me, I've always been a people pleaser, and I've always overextended
Yes.
myself. And that's, I guess, fine and dandy before you have children. But now I actually have
Yes.
people I cannot say no to. I have to be there for, and I do not have a choice. So that's like a big chunk of your
Yes.
n- you know,
Your
person and
agency,
being.
basically.
Right.
Yeah.
And so now you have like just very limited space after that. And
Yes.
so time and boundaries become a necessity. And that has
Uh-huh.
changed my life. I mean, saying no has changed
Oh,
my life. And I didn't realize that that was weighing me down and making me so angry that I was just overextending and always doing all these things. And I really just wanted to chill sometimes,
yeah. And kudos
you
to you
know?
for like realizing that this early. Honestly, I didn't realize or try to like practice that in my life until I think I got pregnant with the twins. And then that's when I like really take a
Oh,
step back and be like, okay, like how am I going to make this all work? And then I realized it was like, okay, no, I need boundaries. I need
uh-huh.
to change my job because my job doesn't allow boundaries. Like being a private
Yeah,
practice OB-GYN, you're essentially available
all
24/7.
the
Pager
time.
goes off.
Hmm.
You have to run, go do a delivery. Um, it's just kind of all consuming. Like it's a good all
Yeah.
consuming. I mean, like I said, like I love my patients dearly. Some of them follow me on Talk Women's Health or like on my personal, and like we will message back and forth because
Hmm.
I mean, we
Hmm.
develop like a bond, like a friendship
Hmm.
almost.
Hmm.
And I really truly miss them. And it's been great because the hospital I work at now is the same hospital I used to deliver at. And so if I
Okay.
ever see a patient, like a former patient of mine, like on the board, I will go in and go say hi to her. And there's tears and we hug
Oh,
and we say hi. And but
oh
it was
yeah.
really like taking a step and figuring out those boundaries to being like, okay, like the real hard boundary actually is my career. My
Hmm.
career is very invasive into my home life,
Hmm.
and that's not going to work. That's not going to jive well with four kids and a husband who has crazy hours.
Yeah.
And so I
Yeah.
had to find a very like structured. So with a hospitalist job, I do 24-hour shifts at a time. So for those 24 hours, I am in the hospital. I'm not home. I don't have to worry about mom things. And then when
Wow.
I'm off and I'm a mom. And so that's where that's
Okay.
like fit in perfectly for me. But like I kudos my some of my really good friends that are still in that group with like they balance life and I don't know how they do it, but I couldn't do it. So I was like, nope, I'm good. But yeah.
Wow. So how often do you do that? 24 hours.
I actually just went up to 5 shifts a month. So honestly, it's nothing crazy.
Oh, okay.
But yeah, but it's just, 5 shifts a month. I keep my license active. I see my patients or, like I do deliveries. I see triage patients. So it's really great for me right now in my season of life. So
Yeah.
maybe when my twins get older and they go to school, then I can branch back into that season. But right
Hmm.
now, this is just where I'm at.
That's really cool though. I mean, because some people do 20, like
Yeah.
that's like a part-time job, but you're able to do it basically in
Yeah.
a week, but of course broken out throughout the
Hmm.
month. That's amazing, actually.
Yeah.
I know 24 hours is,
It's a rough
it
24
sounds
hours, but it's
crazy.
great otherwise. So,
Yeah, yeah. And then you're good for, that's really cool, actually. I like that.
mhm,
It gives a really
yeah,
good work-life balance.
it
So,
does.
what do you wish more moms, especially those expecting multiples, understood about pregnancy and postpartum care?
Oh, that's so multiples. That is just so with pregnancy, my biggest like advice is you can't control anything. When you're pregnant with twins, there's and like a lot of women have a hard time with this, like even the singletons. Um,
Hmm.
you need to be flexible with whatever curves are thrown your way, like curveballs. Like the first ultrasound when you're like, oh my gosh, there's two of them in there. Like that's your first curveball, right? And then like my gosh, there was some swear words said at our ultrasound, and it's fine. We love our twins. But like, so there's that. But like, there's a higher risk of like bleeding in the first trimester, miscarriage, higher rates of like nausea, vomiting, or hyperemesis because you have two placentas if you're
Hmm.
having like modi or di twins. You have two placentas, so you have all the extra hormones there, so you're extra nauseous, you're extra sick, you're extra tired.
Tired.
Um, yes, tired, very
I was
tired all the
tired.
time.
So, not to stop you, but I
Oh,
actually I started having symptoms a week into my pregnancy. I wasn't even testing positive. And yeah, and so I was having aversions. I was already getting nauseous. I was like, and my family was like, "You're being dramatic," blah, blah, blah. And I was like, no. And so that's my husband was like, "You're having twins." And we were like, "We think we're having twins because this is crazy." So anyway, yeah, I was
Yeah.
super, super tired all the time.
Yeah. Oh my gosh, all the time. And honestly, the same
Hmm.
thing with me. I remember testing because I was like super sick and I like wasn't even to the point of my missed period yet. And I was
Hmm.
like, I'm just gonna test. And I tested and
Yeah.
it was like a super positive line. And my husband's like, You're having twins, aren't you? And I'm like, I hope not. I was like, that would be a lot. And here we are. But yeah, no, so going on with like double the trouble basically. So
Hmm.
more women, you feel more the aches and pains of pregnancy earlier. So like,
Hmm.
how most people are like, oh, first trimester, second trimester, third trimester is like when my back started to hurt and blah, blah, blah. Oh no, it's like early second trimester. I remember at 16 weeks, I was starting to get
Yep.
low back pain and all that
Yep.
stuff. And I was like, oh my
Yep.
gosh, this is
Yep.
happening way too early.
Yeah. Four
Um,
months.
I slept in a recliner for the last month of my pregnancy because I couldn't lay flat because I was so big. It hurt so much. So I slept in a
Wow.
recliner.
I couldn't sit. They were really high up, like right
Yeah.
up under. I didn't get very big,
Oh,
actually. Everyone was like, "Are you having twins?" Because my
oh.
sister-in-law was pregnant at the same time as me. So they were like, "Are you having twins or is she having twins?"
You're like, it's me. It's me.
Yeah. They were
Yeah.
so high up, like in my ribs. And so when I laid back, it hurt so bad. So
Oh,
I'm like, I
yeah.
wish because I would sit in my recliner, you buy all the stuff for the nursery, and I would like I thought it was
Yeah.
so comfy and I couldn't sit in it. It was weird.
Yeah. I was like, oh, I lived in that thing. But I was gonna say for twin moms, anticipate more ultrasounds.
Yeah.
You have a lot more ultrasounds because there's growth issues with twins sometimes, and so that's why you want to just
Mhm.
monitor their growth. And you can't do the standard where you just measure the belly and be like, okay, you're measuring just right on track because you can't do that with twins.
Right.
Um, you're higher risk actually for a lot of other things, and I'm sure you went through all this too. But you're higher risk for diabetes and pregnancy
Hmm.
because you have more placenta. So you have the higher human placental lactogen, which increases your risk of gestational diabetes. It's not necessarily that you're unhealthy or you're obese or anything. Like I've seen women who are like 90 pounds get gestational diabetes. Increases your risk for preeclampsia. I Yeah, high blood pressure preeclampsia because you have
Hmm.
two placentas in there. You're at higher risk of your water breaking, like for you. You're higher risk of preterm labor, like what happened with me.
Hmm.
There's the higher rate of NICU admissions, and that's just because you're at a higher risk of delivering your babies premature. And that's
Hmm.
where the NICU comes in. It's just because your babies are
Hmm.
premature. So I don't know if you did the same thing, but when I found out I was pregnant with twins, as soon as we could like re-enroll for our insurance, I got like the Cadillac insurance, like the lowest deductible possible, because I was like, if these are NICU babies, I want really good insurance to cover
Yeah.
that. So that's just like my little tidbit. If you can change your insurance and you know you're pregnant with twins, just do it, just in
Yeah, that's a
case.
really good tip because
One
I
of
didn't
my
know that.
Yeah, it's super expensive. One of my friends, she had twins actually a year before me, and her babies had to go to the NICU. And their bill, she showed me pre-insurance bills, and it was like astronomical,
Whoa.
like 100 plus grand type issues. So, insurance.
Wow.
That was like her first
Okay.
thing. She's like, get the good insurance. She's like, just get the good insurance.
I know when you joke about that,
Yeah.
it's like, no.
And I know, but for reals, get the good insurance. Um, I was going to say, my other thing is like, it is possible to have twins vaginally. Just, I want you to
Yeah.
know that. I know there are some OBs who are not comfortable with delivering twins vaginally. And if you
Hmm.
notice that early in your OB care, and I hate to say this, just find a different OB.
Hmm.
I had to
Yeah.
have a C-section because both my babies were breech. So if twin A is
Hmm.
breech, you just have to have a C-section.
Same. Yeah. Hmm.
I like as long as twin A is head down, you can have a vaginal delivery because when we go to deliver twin B, we either grab the head and pull the head down, or we can deliver twin B breech.
Interesting. Okay.
So that's always, yeah. And it's like some providers aren't comfortable with that. I love a breech extraction. I think it's super fun. So I love delivering twins vaginally. And just know, even if you have a vaginal delivery of twin A, you could potentially have a C-section for twin B. And that's where, like, if you go to do the
Yeah.
breech extraction and bring the head down, there could be other complications that occur, like a cord prolapse or their heart tones go down. So you could end up with a
Mm.
vaginal delivery and a C-section
And
to recover from. Those are, yeah, twin B. Twin B is always the wild card. Twin A is usually totally just fine. It's just twin B. Twin B is your wild card.
yeah. Yeah, when I did know that you could possibly, and I feel like
Hmm.
it's one of those things where you're like, dang, do you roll the dice? Um,
Yeah.
what would be your recommendation? Do you feel like go for it? And unfortunately, if you have that,
Yeah.
then you have that, or
Yeah. Honestly, how to explain this? Vaginal deliveries are fantastic. And if you can do your bait, deliver them vaginally, do it. Majority of mine have all been vaginal. I think I've had to convert from
okay,
a vaginal to a C-section like maybe 2 times. Um,
okay,
but I think comparing recovery of vaginal deliveries and C-sections are like apples to oranges. I've had a
mm,
vaginal delivery, I've had a C-section. They both have their pros and their cons, and they're completely different. So if you really want that vaginal delivery and twin A is head down, go for it. If your
yeah,
baby's breech, like mine were, my little girl just stuck her butt right down in there and didn't move. Um, also
same.
be okay. Like, yeah, I was like, honestly, I feel like a C-section, it's just so different. It's a different type of tired because C-sections are major surgery. Like, I have to remind women all the time, I'm like, this wasn't a simple procedure. Like, I opened you up and you have multiple suture layers in your belly. Be patient with yourself, move slow. Please take the narcotics. If they offer you oxycodone, it's okay. Take it. If you're in pain, take it.
I know they
It's
push
okay.
me
Your
and
baby's
push
gonna be
me and
fine.
push me. I know it was funny because they pushed me and I was like, I don't need that, and they were
Yeah.
like, well, we can't. They're like, we can't prescribe it after you leave, so we'll give it to you. And I don't even take medication for my cramps anymore. I've
Yeah.
started to like wean myself off. So I did just do
Yeah.
the ibuprofen and the Tylenol, but I could only imagine if you're in really, pain. I get
Yeah.
it.
I was gonna say I took it when I was in the hospital. I think when I got home I was fine, which is the ibuprofen and Tylenol. But like in the
Hmm.
hospital when you're up and moving around and there's two babies you're carrying, um, it gets pretty
I
sore.
stood up. Yeah, when I stood
And
up for
then
the first time, I was like,
oh,
oh, oh my goodness.
you're like, oh, this hurts. This hurts. This
Yeah.
hurts. Oh man. But yeah, but like the differences are like when you have a C-section, like you can sit down very comfortably. It doesn't hurt to sit
Hmm.
versus vaginal delivery where, 90% plus women tear and have sutures, like it hurts to sit. It hurts to sit on the
Oh.
toilet, to push a poop out, to go pee because everything stings and you have to tear and you have to like blot it very carefully. So like it's either vaginal pain or abdominal pain. They're two different types of pains. Because I remember my
Mm-hmm.
husband, we were walking around and he was like, you're moving a lot more. He's like, you never moved this much after the vaginal deliveries. Because I had a really bad tear with my first one and then like a not
Mm.
too bad tear with my second one. Um, but like it hurt to walk, it hurt to sit. It versus C-section, I was like up and moving around. And I was like, oh, this is great. This is just some pain down here and I'm fine.
Yeah.
So everyone was different. And there's women who don't tear and they don't have that pain at all. So it's just every
Mm.
woman's journey is different. But like if you are pregnant with twins and you want that vaginal delivery, great. If you're like, nope, I don't want to have the potential of a vaginal C-section, it's also okay just to have a C-section. I mean, I've done both for patients.
Mm-hmm. And do you feel like that the massage that they talk about is have you seen women say that they did the massage and it didn't
Yeah.
tear?
So yes and no. Studies have shown that actually does decrease your risk. So like in the
Okay.
later third trimester, around like 36, if you want to just do some like perineal massages or do it while during labor, um, warm compresses during labor can also kind of help with that as well. Studies, yeah, have shown that it's statistically significant. I've seen someone do that who have did tear at all, and I've seen some women who do that who've gotten like a third or a fourth degree tear. I think once
Oh,
again that just goes down to your anatomy. Um,
okay.
and just how lax your muscles are when you're delivering.
Okay. So it's helpful,
Yeah.
but it still might happen.
But it's not 100% preventable. No. Yeah. Like everything in
Okay.
OB.
Yeah, like cons. No.
Yeah. Like everything. Being a mom, nothing's
I
100%
know.
anymore.
Oh my goodness.
Yeah.
Okay. I'm like, I was thinking,
No,
So,
you're good.
how do you personally define more to love? Particularly regarding twins in this
Yeah.
chapter of life.
Oh, I didn't think my heart could love as much as it does. More to love. It's there's something special about having two babies just on you, loving you, giving you kisses. Um, I don't know. It's just they're, I mean, sure, you have two girls, right? If I remember correctly.
Mm-hmm. Mm-hmm.
Like they have completely different personalities. Mine have, like, I have boy girl twins and they are completely different
Okay.
personalities. And it's just so fun. It's just fun seeing them
Mm-hmm.
grow up. And like sometimes you just stand back in awe and you're like, I gotta be your
Mm-hmm.
mom.
Yeah.
I gotta be your mom. Like, this is so cool to watch you two
Yeah.
like share food on your trays. Like, one doesn't like something, so they'll dump it on the other one, and what they don't, they dump on the other one, and then they eat it. Like, it's just so fun. So,
That's
more to
silent
love.
communication.
Oh my gosh, it is definitely silent communication. Like,
Yeah.
one will run and grab the other one and then come back. And I'm like, you guys didn't make a peep. Like, how did you communicate? What was happening over here? I don't know. Just, I try to think of like how to define more to love. It's just, it's special.
Mm-hmm.
There's something special about being a twin mom and like trying to comfort two babies when one's crying in the crib and you're holding the other one. You're like, I love you. I'm sorry. I'll hold you in a minute. It's just, I feel like it stretches you to limits that you didn't think you could be stretched to, but you have to get stretched to them because you're a mom,
Mm-hmm.
right? Like when you're
Mm-hmm.
tired and you're exhausted or you're just like, I can't do this, but you have to
Mm-hmm.
do it
Mm-hmm.
because their lives
Mm-hmm.
depend on you.
Yeah.
And I
Mm-hmm.
think it just pushes you to become the woman that you never thought you could become.
Yeah. I know. I love that you said that because when people were saying, like, I don't know how you do it, like, I couldn't do it. And I'm like, if you had twins, you could do it.
You just
It's,
do it. You
you
just
would
do
do
it.
it. You would have a choice. You would do it. And that's why I don't like people are, sometimes my husband will be like, they only have one, they're tripping. I'm like, but that's their reality. They have
Yeah.
one and that's all they know. So they've been stretched to that
Yeah.
capacity. You know what I'm saying? I'm like,
Exactly.
we just got, the luck of stretching
Two,
double the
double stretching.
capacity.
I know.
But
And that's the
their
other thing
heart
I
is
say
just
too.
as
I'm
hard as
like,
ours.
it is. And I'm always like, I'm highly
Hmm.
caffeinated. I'm like, that's I'm like, I drink. There's a lot of caffeine in my system right now. No, but for real, it's like I remember like it was really hard with my first kid and there was just one. It's
Hmm.
just different hearts. You know
Yeah,
how to navigate certain things and then you get a different one and but yeah, it's just your reality of what you're living in. You just deal with it
exactly. I know. It's just, different every time. I hope I have one next time
every
though.
time.
No.
I know.
I hope
I
it's
can't imagine two
just
sets of
one.
twins. Oh, me
I'm
too.
like,
For you, yes.
please, please, please.
You're like, this is easy. Oh,
Yeah. So if there was one piece of advice you could give patients or if what's one piece of advice you give your patients that you wish every mom could hear?
ooh. I honestly, it just goes back to being flexible. One thing that I like to tell patients are, I don't know when you're going to go into labor. If I had a
Hmm.
crystal ball, I'd be a millionaire. That's what I tell them. If I had a crystal ball. And the other one is with labor, um, we like to pretend we're in control. We're not in control. We're never in control. We like to pretend that we can like guide things, but just be flexible, roll with the punches during labor. If you have a beautiful vaginal delivery, I'm so happy for you. If your baby's heart tones aren't looking good and we're having to intervene, it's okay. Like, my goal at the end of the day is a healthy mom, healthy baby.
Hmm.
And I know there's a lot of bad talk out there about OB-GYNs, and I just want to set the record straight. We care. We truly care. And I know there's there are some there's a bad person in every single specialty of any sort of
Yeah.
job, right? But I would say
Hmm.
majority of us we care. We truly care about the woman. We truly care about the baby. And what we're recommending at that time is what we feel is the best for you and your baby. Of course, hindsight is always 2020, right?
Hmm.
Like there are some deliveries where you're like, you look back and you're like, I could have changed that. But at the time,
Mm-hmm.
you're dealing with the best cards that were dealt to you at that
Mm-hmm.
time and trying to make it.
Mm-hmm.
So my one word of advice is just vaginal deliveries, you don't get a trophy for them, right? You don't get a trophy. Your trophy is a healthy baby.
Baby.
And it does, or babies. And it doesn't matter the route that they came into the world. As long as you're alive, your baby is healthy and alive. Like that's what matters at the end of the day. And people just like to romanticize labor and they want to romanticize everything. It's hard
Especially right now.
because you see
It's
this, and then
crazy.
when you're not, and then when you're not having that perfect labor that you romanticize in your brain, like you're gonna have a moment where you're gonna break down,
Yeah.
and it's just be flexible.
Mm-hmm. Yeah. Be
I've never
realistic.
had
No.
I've never had two labors that have gone the same way. I know, and you have to be flexible. You become a mom, and like, oh, I'm sorry, I have so many words of advice, but like labor and pushing, I always tell women like this is your first test of motherhood.
Mm-hmm.
You have to be flexible. You have to push through the hard, especially when they're pushing and they're like 3 hours into pushing and they're like, I can't do this. And I'm like, you have to do this. Like, like this is motherhood. Motherhood is when you have nothing left in you, but you keep pushing.
Yeah. Yeah.
Yeah. So that's
Yeah.
just I guess my mother and my doctor advice. But
And I know you
uh,
mentioned that you have, your spiel on C-section postpartum. What is that?
yeah.
If you can regurgitate that here.
Yeah, so this is for like women who have like a scheduled C-section, like they know when they go into labor delivery, they're having a C-section. So I always just talk about, so if it's scheduled and you're not going in with your water broken, like the nurse will take you into either a room or a triage room. They'll have you get
Mm-hmm.
undressed, they'll put your baby on the monitor, they'll take vitals, you'll get an IV started, we'll draw blood, right? Dad or
Okay. Mm-hmm.
partner, he will get like the jumpsuit on to put on
Mm-hmm.
over his clothes. And I always just make the point of don't put the cell phone in your pocket, keep it in your hand because when you're in the jumpsuit, you can't get into your pocket to take pictures of your baby.
Yeah.
So that's mine. I talk about how like I'll come and do the consent. Your anesthesiologist will come do the consent, and then you'll walk back to the OR. Once you go into the OR, usually that's when you're separated from your partner. That is a hospital policy, anesthesia policy. OBs have no say in that. So if
Mm-hmm.
that's something that you don't want to happen, talk that up with your nurse. Ask the anesthesiologist when they're talking with you. OBs, we don't have any jurisdiction over that part. But you get separated from your partner while you sit up
Mm-hmm.
and they do the spinal. The spinal is kind of like an epidural. It's just a one-stop shot of medicine that they put in your back. It feels like a bee sting, as I'm sure you remember too, if you're awake for it.
I didn't feel it, but yeah.
Oh, really?
Yeah, it was weird.
Yeah, it feels
Yeah.
like a beast.
He was like, "Are
You're
you
probably
are you
mentally
good?"
somewhere else.
Yeah, I was. So I was like, it was more of like when you're getting a massage and they hit that like pain point, you're like, "Ooh." That
Oh,
was what it felt like for
yeah.
me. But anyway.
Oh, that's so funny. But yeah, so
Mm-hmm.
I tell them like you're gonna get the spinal, your legs are gonna get really warm, fasten the lay back on the table. You're separated from your partner this whole time. I talk
Mm-hmm.
about
Mm-hmm.
how we do the prep on your belly. It looks like a bad
Mm-hmm.
spray tan, is what it looks like. um, and then that has to dry for 3 minutes. So you're just laying there for 3 minutes, nothing's
Okay.
happening. And it's because we're letting that dry. Because if it's not dry, it's alcohol based. And if we use our cautery, we could actually light you on fire. So that's why we let it dry. I
I
know.
let that dry.
And you're laughing. OR fires have happened because of this. So it's a, yeah.
Okay.
But anyway, so we let you dry. So, and then the blue drape will go up. So that's when we
Yeah.
put the blue drape up. And then that's when we pinch you really hard. We pinch you with a very pokey forceps to make sure you're numb. So if you're like feeling somebody touch you, I feel like it's like when you go to the dentist, right? Like your mouth is numb and you're just like, hey, I can feel this, but it doesn't hurt. That's what it should
Yeah.
feel like.
Yes.
And so like you shouldn't feel the hard pinch. If I were to pinch your hand, you would absolutely scream at me if you felt that. So if you are feeling anything sharp, speak up. Because we'll say,
Mm.
hey, mom, you feeling this? And she'll be like, no, I'm good. Or like, yeah, I'm feeling something. But if you're feeling just touch, you're fine.
Mm-hmm.
Once we know that you're nice and numb, that's when the partner gets to come back and they get to sit next to you. So you're laying like this, they're sitting here right next to you. And then we start. And we start to have a baby. Usually from incision to baby is usually like less than 5 minutes. It's pretty fast. And then we get baby out. Usually it depends on how baby's doing. Dad can usually go over to the warmer. The nurse will walk you over there, and then we
Mhm.
close. This is the longest part of the C-section because we need to put everything back together. And so you want us to take our time here. Usually that part lasts about 20, 30 minutes, and then that's it. And then we put you onto the bed and you go into recovery. So that's usually my spill. So you kind of know play by play what's going to happen. So there's not really a lot of surprises. It's fairly common for women to throw up during a C-section. I don't know if you did
Mhm.
that. I dry heaved a
Yes.
ton. It's just the fluid shifts are so fast in a C-section, and with the spinal, it can drop your pressure. I know I didn't throw up until my babies were out, and that's usually when I notice women usually start to gag is after the baby's delivered. It's because we have to do stuff with the uterus, which pulls on certain parts of your body that will make you
Mm.
nauseous. And so it's just probably going to happen. They'll hold a bag and you'll just gag into it. And it's very fun. And I'm totally being sarcastic there, but
It was awful. It was just like you might
yeah,
start to
it's
look,
awful.
he was like trying to tell me you might start feeling nauseous, and it was like, "Bleh." Yeah.
Uh-huh. And my anesthesiologist, like him and I have worked together for 4 or 5 years. I started to get nauseous and he saw my eyes gaze up towards like my blood pressure because I was like, oh, this doesn't feel good. And he's like, what you looking at, Porter? And I was like, what's my blood pressure? And he's like, oh, you're gonna get nauseous. And I was like, mm-hmm. And then like I started throwing up. So like, that's just because I know what's gonna happen. But he was
Hmm.
just like, what you looking at? And I'm like, what's my blood pressure? I'm gonna vomit. So anyways, but yeah, that's
That's
kind of
so
like my play by
interesting.
play that I tell patients. I know,
No,
it's
I
so
like
weird.
that, and I feel like I just relived.
Oh my gosh,
I
right?
was walking with you. I was walking with you as you were giving that spiel. I'm like, yeah,
Yeah.
yep, that's what happened, and
Yep. That's what
it was so
happens.
emotional getting separated from your partner. I think that
Hmm.
was very hard as well. My husband was crying. I was
Yeah.
my
No,
husband was
there's
calling
usually a lot of
everybody like,
tears.
mm-hmm. I don't know. Kaylee's been there so
Honestly,
long. And
if you don't feel comfortable with that, I'm like, it never hurts to ask. Right?
oh, I
What's
didn't
the
know
worst
that
they're
you
gonna
could.
do? The worst is they're gonna say no.
Hmm.
Just say, hey, can my partner be there with me? And if they say no, okay, that's the answer. But if they say yes, then great. Like your partner gets to
Yeah.
be with you now.
Hmm.
Yeah.
Yeah, because that was really hard. Being separated
Yeah.
was hard.
I was gonna
Yeah,
say, and
because
my
you're just
husband,
like,
he was in there with me. Yeah. It's hard. It's scary. Like for me, I'm like, I go into the OR every day. Like this is just run of the mill. So like I'm not scared going back there. But for someone who's never been in an operating room,
hmm,
it's very sterile. It's
yeah.
very clean. It's very everything that you not cozy comfy, right? It's very
Yeah.
cold.
There's so many people,
So
especially with multiples. There's
so many
so many
people.
people. Yeah.
Oh, yes. That is the other thing that I forgot to mention that. So I always tell patients like you have your anesthesiologist, you have your OB, you have their assistant surgeon. So either it's an OB or a PA, you have your scrub tech, you have your circulating nurse, you have usually two people for baby. So that's at least 7 people for a singleton. When you have twins, you have all that plus at least 2 to 3 per baby. So you have 6 extra people usually in a room.
Wow. Okay. I
So,
mean, of course I was there,
yeah.
but it's like it's nice to
Yeah.
know like the names of everybody. The
Yeah,
rundown.
all the people that are there. And then usually if
Yeah.
they're premature, then you have more people there because like the NICU's ready to be like, okay, do they
Hmm.
need to come to us?
Yeah. Yeah. There
So,
was so many people, and I asked to nurse right away, and everybody was like so
yeah,
surprised. Um, and then they latched, and they were even more surprised. So
you're like, yes, I got this.
yeah, yeah. My experience was I'm really thankful for my experience. I feel like that's
Yeah,
like I'm really really thankful for that experience. And so for postpartum C-section, how what do you recommend for that in terms of taking care of your incision, what you can expect,
yeah,
and then of course, like for moms who are considering getting back in the gym or working out, things like that, what is your advice for that?
yeah. So, in the hospital, honestly, the soonest you can move, start moving. So, like getting
Hmm.
up and not like laying in bed all day, get up and walk.
Hmm.
Um, That will help your intestines move so you don't get constipated because taking
Okay.
narcotics constipates you. And that gas pain can be super painful and trying to push a poop out when you already have an incision on your belly. So movement is really key. It also prevents blood clots. Take your Tylenol, take your ibuprofen. If the nurse is like, "Hey, you might actually need this narcotic," take it. Ice packs are fantastic on your incision. It just
Mm-hmm.
depends on how they close your incision, whether or not there's a skin glue or if they do staples or just put
Oh,
the dressing over the top of it. It's every surgeon, it's just dealer's choice is what they like to do. I do a skin glue. Usually when you take a shower for the first time, you let the soapy water run over it. You don't scrub it. And then when you get out of the shower, you just pat it dry. Every woman has the belly that falls over the incision. That is normal. If you feel like it's not getting dry, you just kind of lift it up and you put your blow dryer on cool and you just kind of air dry it that way. And then you can put a maxi pad on it too. That just will whisk away the moisture
yes.
and keep it dry.
Yes.
hmm
Mm-hmm. Mm-hmm.
the biggest key is keeping your incision dry to prevent infection.
Mm-hmm.
So if it bacteria love dark, moist areas, and so if you can keep it dry, that is going to do wonders at preventing an infection. As far as like getting back to the gym or whatnot, you've had major abdominal surgery, so I usually most OBs have you follow up at 2 weeks. In those 2 weeks postpartum, just use the stroller and walk around with your baby or babies. Put your baby in the
Mm-hmm.
stroller. Like if it's like beautiful weather outside, just go for like a little walk. And if you start to notice your lower back starts to ache or anything, just go back in. That means you've overdone it. If you're
Okay.
inside because it's winter, just push the stroller around the house or, just get up and walk. Walking is
Mm-hmm.
key.
Okay.
Walking helps build so much core strength because being pregnant destroys your core, literally just destroys it.
Yeah.
And then as far as like working out, after those 2 weeks, you have to be like there's called transverse abdominis breathing, so TVA breathing. And it helps
Okay.
you engage your core and it also helps with your pelvic floor to go up and that helps strengthen it. And then you can do something where it's called, oh my gosh, what is it called? Like heel slide. So you lay on your back with your knees bent and then you just slide out one knee, you slide out one knee, and that just kind of helps build your core back up. And then
Okay.
just like little tiny pelvic tests. So there's very small movements that go a long way in building back your core. And this honestly even goes
Mm.
for vaginal deliveries too. Don't go straight to the crunches, don't go straight to the planks. All the rectus muscle stuff, don't do it. You want to work on your transverse abdominis, which is your actual core set of your belly.
Yeah.
But yeah, that's kind of like working out postpartum for C-sections.
I
It's
like
just
that.
slow. Go slow. Everything's healing.
Yeah, I feel like some, with this bounce back culture and everything like that, so many
Oh,
people are like, I need to get my body back together. And, you know, I would say like after a year, my husband went to go pick me up like over his shoulder and like basically put my abdomen on his shoulder. And I was like, ah! Like
uh-huh.
it
You're like, that
still
hurts. Yeah.
hurts. Yeah.
Yeah.
So it's
I was
I
like, my
he hasn't
my
done that
incision's still
again.
numb. Like I'm still
Yeah.
numb. Yeah.
I'm like, he hasn't done that again, so I don't know where I'm at with that. But
Yeah.
I mean, certain
Oh,
things I'm like, I still feel it, like when my daughters do certain things. So I'm
yes.
very conscientious of it's definitely still healing, and it's been almost 2 years now. So
Yes. Yeah, it's definitely
yeah.
still in. There's scar tissue there. Your body's never going to be the same. It's not going to go back to
Hmm.
pre-pregnancy ever. And just love your
Hmm.
body. It created a
Yeah.
human. It created two humans. Or if you have triples, it created three humans.
Yeah. Yeah.
Like it did a lot. It did a lot of work. It did a lot of work. Just be gracious with it. And I mean, I have to mentally tell myself that too. So I'm not perfect either. But
I mean, I love my new hips though.
uh, yeah, exactly. For real. So that they're nice and big there. They're there.
Yeah.
Oh man.
I know.
I
And
love
then
it.
with working out, if you're aware, with working out and like breastfeeding and stuff, because with my lactation consultant, she let me know that
Oh yeah.
it's only safe to kind of like lose 1 pound a week. It was hard for me though because I was always scared that I wasn't going to produce milk, so I was like, I need to eat
Yeah.
in order to produce milk. And so like I was scared, but I was definitely gaining weight, so I must have been eating more. I don't know, but do you have any advice
Yeah.
on that?
Yeah. So, um, working out necessarily actually doesn't drop your milk supply. Studies have shown that as long as you compensate with your liquids and your calories. So
Okay.
when you're breastfeeding, if you think about it, for breastfeeding for a single baby, you're producing about 24 to 30 ounces, right, of milk a day.
Mhm. Mhm.
Twins way more than that. So you think
Mhm.
you have to at least drink that much to produce the breast milk, and then you have to supply yourself. So you need to be
Right.
drinking about like 90 ounces of liquid a day.
Okay.
So if you're not doing that, of course your supply is going to drop because your body's like, I'm not going to produce breast milk. I need this for me. And so if you're
Right.
exercising, you want to make sure you have like an electrolyte drink in there. So whatever your choice is of electrolyte drink, replace that with at least 30 ounces.
Mm.
Make sure, so breastfeeding requires about 500 extra calories per day when you're breastfeeding one baby. When you're producing enough milk for two, it's probably about an extra 1,000 calories per day. So you need that extra 500 on top of like an 1,800 calorie thing. And then if you're
Mhm.
exercising, you're burning 200 calories, and you probably need an extra 200 calories to make up for that deficit. So that's how I kind of talk to patients about it. It's not necessarily that exercise drops your milk supply. If you're not exercising smart and replenishing your body smartly, yes, it's going to drop your supply.
I
Um,
see.
and the weight loss, of course. And I used to, so I remember in residency, I learned that they were like, oh yeah, breastfeeding, you lose weight breastfeeding. No, you don't. That's such the biggest lie. That is the biggest lie told to women. You do not lose weight breastfeeding. And if you do, you are the minority. Majority of women don't lose weight breastfeeding.
No, I
And
didn't.
that's the biggest lie there that's told to women. And I didn't know that until I breastfed. And then I was like, why is the weight not falling off? Like, what the heck? I've told patients
Mhm.
this. So you don't lose weight breastfeeding. It's just
I
what it
wish
is.
that'd be, yeah. I was
Yeah.
like, I should be, losing something. I'm getting bigger.
Yes.
No.
No, and like I noticed my body had a weight. Like if my weight ever dropped below this number, my supply would drop. And if I got back up to that number, my supply would go back to normal. So
Mm.
I don't know. Maybe there's just something, maybe it's just my body that had a magical weight where I could just produce what I needed. And so
That's
then when I stopped
interesting.
breastfeeding, that's when I dropped below that number. So
Hmm.
I don't know.
I
I just,
see.
there's
I
so much
see.
about women's health that we need to know that we don't know.
Yeah. And I think though there was a study where they actually weren't testing. Well, this might be bad to regurgitate,
Yeah,
but like they
you're good.
weren't testing women because like, back in the day, men just assumed things about women and kind of went off assumption, that type of thing. I don't know if you have
Yeah.
heard that.
I feel like a lot of obstetrics, I mean, I love my field. That's why I went into it. I'm happy that more women are in it because I feel like we're going to revolutionize it.
Hmm.
Because we're like that. No, I feel like, yes, there's a lot of things where men were like, you're fine, like
Hmm.
you're okay. And it's like, no, like actually, like this hurts.
Hmm.
Yeah, I agree with
You
that.
don't know because you've never been here before.
You don't have a uterus, you don't have a vagina, you don't have any of that. And see, you don't know what it
Yeah.
feels like. You don't know what menstrual cramps feel like. You don't know what like actual like labor contractions feel like. You don't know what it's like to recover from a vaginal delivery. You don't know what it's like when you're leaking from every orifice of your body and keeping something alive. Like it's a lot.
Yeah.
It's a
Yeah.
lot. And
Yeah.
I
I
feel
love those
like
TINS
that's
machines that they're
why,
putting on. You go.
yes,
Those TINS
like this is
machines
what
that
it
they're
feels like.
putting on men. Yeah.
Oh yeah. Like totally what it feels like. I don't know. So I feel like OB is gonna it takes a lot to move medical stuff. And so I feel like
Hmm.
that wheel is turning because more women are going into it and more
Hmm.
women are being like, okay, no, like let's fix this.
Yeah.
And that's why you're hearing a lot more about postpartum, right? Because
Mm.
a lot of us, like me, like I didn't really fully understand. Like when you're in training, they're like, yeah, you do the 6 week visit, tell them they're cleared for sex, ask what they're gonna do for birth control, if they're breastfeeding, formula feeding, like that's it. That's all you need to know. And then like the more you see women and then you go through postpartum, you're like, oh, this is way more complex than that.
Hmm. Hmm.
But it's what it is. So yeah.
I know. I feel like my incision too was also like barely checked. But that tip of using a maxi pad over it. That's what I
Oh,
did
yeah.
because they told me that they kind
Okay.
of did that in the hospital. And then for me, it felt like it acted as like a, what's it called? A like a stint where you like, if you like hold onto a pillow and it kind of provides
Oh, yeah.
compression. I don't know, for some, maybe it
Yeah.
was mental, but I feel like it also provided like support on
A
my
little extra
incision.
support. Yeah.
Yeah, especially because you get the nice thick pad and just put it right there. And also, if your like the seams from your panties
Oh,
don't rub
yes.
up and kind of cause friction, that also really helped with
Yes.
not having like, and honestly, my incision,
Yeah.
you can barely see it. Like I've seen some people's
Yeah.
incision and they look gnarly.
Yeah.
Mine, my husband's like, you can barely see it. And I'm like, I know. No.
You're like, yes. I know, same here. Some women, it's true though. So some women keloid, and you usually know if you're a
Mm.
keloider, it's where you like produce extra
Yeah.
scar tissue. Like you'll know that. But yeah, I know some women you're like, oh yeah, you had a C-section.
Even I've seen that they don't keloid, but it just, for some reason, it just, I don't know if it's the way that the
Oh,
doctor did it, but
like the way it like bunches up a little bit.
yeah, it looks
So
like,
that's usually the scar tissue. Yeah, it kind of goes like that. So that's usually the
yeah.
scar tissue that forms underneath it. And so I usually tell
Oh.
women, you want to massage that, or if you find somebody who does like scar tissue, like release, go to
Mm-hmm.
them. And that kind of helps loosen up the tissue underneath it because it's just the way that
Mm-hmm.
your body healed and scarred against the suture that's underneath your skin.
Okay, so you don't feel like there's
Yeah,
any way to, because I was like, is it the way I took care of my incision, or you think it's just the way your body?
it's just the way it healed. And if
Okay.
it looks wonky like that, and if you're going in for like a repeat C-section, I'll be like, do you want me to just take the scar out? And I'll take the scar out and
Oh.
then just like put it back to get like a new one together.
Can you ask for that without having the doctor say
Mhm.
something, or yeah? Okay, that's a
Yeah,
good tip.
yeah. Just be like, I don't like the scar. Can you just take it out? And I'm like, oh yeah, that's easy. And it's just honestly, it's simple. It's an extra like minute or two.
Oh, okay, that's nice. Nice.
Yeah.
I hope if there's someone that doesn't
Yeah.
like their incision, their doctor is like, yeah, sure, I
Except
got
they could hear this and know this. Yeah, exactly. Honestly, usually I'll just say it. Like if I know it's a gnarly one, I'll be like, you don't like this, do you? And they're like, no.
I got you. No.
I got you. I could help. I could help you. Oh man.
All right. So if you could offer one
Yeah.
last heartfelt message to new or expecting moms listening, what would it be?
Oh. Honestly, just love yourself. Ask for
Yeah.
help. You don't have to do this
Yeah.
alone. That is,
Yeah.
ask for help. If you are in the trenches and you are drowning and you are like wanting to hurt yourself or hurt your baby or just run away, like if you have that, you just want to run away, reach out, get some help. Somebody will help you. I know they will. Your OB will help you. You're wanted. Your baby needs you. Your partner needs you. Your family needs you. And being a mom is hard. And it's being
Hmm.
hard. It's even harder in this society when you can go on Instagram and just see perfect moms. They're not perfect. They're just perfect on Instagram. Just that's my thing. Is just love yourself. Be kind to yourself.
This has been awesome. I really had a great time chatting with you. And
Yeah.
again, I really appreciate you taking the time. I know we have such limited time and time is precious as moms. And so thank you so much for chatting with me. And if you can just let the
You're
listeners
welcome.
know how they can connect with you and the Informed Woman.
Yeah, so you can find me on Instagram or TikTok at Doc Women's Health, or if you're interested in my courses, theinformedwoman.health is where you can find that, and I will have the courses listed easily on the website for you.
Perfect. And then, of
Yeah.
course, you can follow me at Kaylee Berlini on all social media platforms. Follow the podcast at Mothering Holistically on Instagram and Facebook. This is where you will find any sneak peeks, all the announcements of upcoming guests and shows and themes. All of that happens on the podcast Instagram. It doesn't happen anywhere else. So if you want to know early announcements for the podcast, you have to follow the Instagram and then tag us hashtag Mothering Holistically podcast. If you learned anything new, I definitely learned a lot of things, even though I've been through a lot of what we discussed today.
Yeah.
I did not know some of those tidbits. And so hopefully y'all took something away. Or if you are an expecting mom listening to this, and now you can be a little bit more informed as an informed woman. And
Thanks.
if you like this episode, if you like this episode and feel it resonated with you, please give it a thumbs up by clicking that like button. And if you feel it could encourage someone that you know, please share it and subscribe or follow if you're listening on Spotify or Apple Podcasts, while also hitting that notification bell to never miss a weekly episode. We have episodes coming out every Saturday at 6 a.m. Pacific Standard Time, so you don't want to miss it. So until next time, remember to mother holistically and thrive authentically. I'm your host, Kaylee Berlini, and together we're winning. Bye, y'all.